Coming up on September's episode of the CANdid Connection, the Michigan legislature is back in town, and so we'll talk about issues that they'll be facing here in the coming month, including getting a budget deal done before we run out of time. We're also going to take a quick moment to talk about what's happening federally. Ashley and I will be chatting back and forth and what's happening there. Ashley will also be chatting about Leadership Summit and Lobby Day. That's right. Volunteers will be virtually ascending on Washington, D.C. here late in September. And so we're going to be chatting about some of the issues they'll be talking about, what to look forward there. Our guest this month, we're really excited to welcome Deidra Wilson, who's Vice President of Government Relations and Public Policy for McLaren Healthcare. She's going to be chatting about some of the issues that McLaren's working on, where McLaren and ACS CAN and patients and providers can really kind of work together, and offer her insights in terms of what she thinks some of the issues will be coming up in the legislature as we move into the fall season. So I'm Andrew Scheppers, along with Ashley Hall. This is the CANdid Connection. Well, happy September, everyone out there. We're happy that you're able to join us again for another episode of the CANdid Connection. And look who's with me. It's Ashley. Hey, how are you?
Hey, I'm good. How are you, Andrew?
I am good. I'm good. And I'm excited you're here and excited that now we're doing our first episode together.
Yes.
So hopefully, hopefully you won't be like, this is the last episode I'm going to do.
Hopefully I don't sound silly. Hopefully, we're vibing and it just goes really well.
That's right. That's right. Well, and, September means back to school, right? So
Yes.
Here we are. It kind of feels like first day of school, doesn't it?
It does. And the weather's cooling off a little bit, which has been really nice. I was definitely looking forward to that.
I know, me too. I love the fall. It's one of my favorite times of year. But
Yep.
Fall also means the legislature comes back too, and they
Yes,
quote unquote go back to school. And so we can get into talking about our state updates here a little bit. But we've got really more building on our efforts around oral chemo fairness, and also dealing with our budget ask, which again is $200,000 for the tobacco prevention line. But the clock is ticking for folks here in Michigan to really get the budget done, isn't it?
It really is. Yeah, we're getting close to the finish line.
Yeah, we are, and we have that stop date of September 30 here in Michigan for lawmakers to figure out what their budgets are going to look like, and how all that is going to be handled. And so we have that $200,000 on there. Everything we've gotten back, everything sounds positive, doesn't it, Ashley?
It does, and I know that our volunteers are definitely looking forward to that leadership from our legislature, and we're definitely hoping to see that both of our items get passed in this budget.
Yeah, no, absolutely. And so, we're continuing to touch base, and I'm sure that we're going to be doing a little more work about that coming up. But, clock is ticking. So I just kind of wait and see. But I would expect some type of action with here the next couple weeks in September. So, but with that, it's also oral chemo fairness and House Bill 354, our major campaign issue that we've been working on this past year. And so, our volunteers really took the opportunity to reach out with members in the Senate, didn't they, during kind of that August time period?
Absolutely. Yeah, they were really, energized over oral chemo. It's such an important piece for our cancer patients and survivors. So they're very animated, they're very excited, and they had some really good conversations.
Yeah, no, we've been getting great feedback, and so thank you to those that were able to go ahead and reach out to their lawmakers. But we're starting to make the rounds again as well, and hoping that Chairman Vanderwall and the Senate Health Policy Committee will take up, will take up the oral chemo legislation. But it's really kind of a wait and see right now. But fingers crossed, if we kind of keep that drumbeat steady, hopefully we'll have an opportunity to have a hearing here before the holidays.
Yep, fingers crossed.
Fingers crossed. So, well, there's also been a little bit of action in DC as well, and we've really been talking about over the past month. Really talking about actions around research funding and adding more dollars there, haven't we, Ashley?
Yeah, absolutely. We have a big event coming up federally, our federal lobby day coming up at the end of September, where all of our volunteers from around the country, but in Michigan, obviously, will be speaking with their legislators about some important asks.
Yeah, no, that's right. That's right. September is Leadership Summit and Lobby Day month, and so our volunteers get jazzed up about that and talking about some of our federal issues. But we really start with August to kind of grease those skids a little bit, don't we? In terms of maybe kind of previewing some of our issues a little bit.
Yeah, absolutely.
Yep. So we'll get ready for that. But here after the break, we talked about Leadership Summit and Lobby Day. Ashley and I are going to kind of preview what's coming up and what we can expect in terms of our asks, more than just the research funding ask, but we've got a couple other in there. And really talking about what to expect as we move into another virtual leadership summit and lobby day here in September. So stay with us. We'll be right back right after the break. ACS CAN Michigan is excited to announce its 2021 policy forum, The Faces of Cancer, where we're going to take a look at access issues that cancer patients are facing here in Michigan. Our forum will be on September 30th, 2021 from noon to 1 Eastern and is a virtual event. We're excited to welcome our keynote speaker as well, Dr. Sabrina Ford from Michigan State University. She's going to share insight on her research and what she's seen in terms of barriers of access for folks here in Michigan. We hope you can join us. Head to fightcancer.org/MIFaces to get more information or register today. And welcome back. Thanks for hopping in. We got our policy forum coming up. So if you have an opportunity, I think it's going to be a real cool program we'll be putting on. Great information. Again, head to fightcancer.org/MIFaces to register today. So Leadership Summit and Lobby Day. It is finally here, isn't it?
Yay! It's my first one. I'm very excited to kind of be along for the ride and learn a lot from the volunteers, honestly, because they've been doing this for a long time.
Oh my gosh, ain't that the truth? I mean, the level of knowledge and expertise that our volunteers bring to our, at least the Michigan delegation, is extremely impressive. Whether they're brand new or they've been doing it for a while, they're very well educated. And that's, I'm going to give you a little shout out, Ashley, because that's all the great work that you do to prep them and have them ready to go. So. But we talked a little bit earlier about research funding.
Yes.
And so, we've got some asks this year. I mean, we normally do, right, when we go to Leadership Summit and Lobby Day, but we've got some asks this year. And so, Ashley, could you kind of fill us in on what some of those asks are?
Yeah, absolutely. So, these asks kind of come down from our policy team in DC, and they're really great and they're really focused. Because when you have these meetings with legislators, you want to have really specific focus asked in order to get an answer. So this year, like you mentioned earlier, we're focused on research funding. So we have an ask of 5.17 billion in terms of cancer research funding for the NIH. A little bit of that is going to go to the National Cancer Institute. A little bit of that goes to the CDC. And a little bit of that goes to the National Breast and Cervical Cancer Early Detection Program. But outside of research, we're really focused on, those expanded ACA tax credits.
Okay.
They're going to be expiring at the end of 2022. So we're going to be asking that those are made permanent in the upcoming infrastructure package. The infrastructure package that has getting a lot of attention right now, there's some healthcare stuff in there. Healthcare is infrastructure.
That's right. That's what it is.
And last but not least, there is a Medicare multi-cancer early detection screening coverage bill that is both in the House and Senate. And we're going to be asking our legislatures for a co-sponsorship on that as well.
Gotcha. So it sounds like a lot of great stuff. I mean, $51.7 billion for NIH and $7.6 billion for the NCI. I mean, that is huge. That's got to add such an impact in the fight against cancer. But, the Expanded Affordable Care Act tax credits, I think, are really going to make the difference in terms of making sure that folks are having healthcare coverage, right? I think
Absolutely.
that, Michigan was a state a few years ago before I came on. They expanded Medicaid to provide coverage for those that needed it. And it's been great in terms of making sure that folks now have health insurance and they have the ability to go ahead and seek out the health care that they need. But, for those that are paying their own way, right? I mean, we're talking about this with oral chemo right now. I mean, our oral chemo bill really affects those that are paying their own way. And so if they can get even some more help on top of that and know that they can get the health care that they need, and if we can get oral chemo passed, access to all of the treatments available, or a good majority of the treatments available to treat cancer, gosh, what a win-win.
Truly, strengthening that access to care piece is such a huge priority for ACS CAN, and all of these, and all of these asks are, just going to get us one step closer to helping cancer patients get the care that they deserve.
Yeah, absolutely. Absolutely. And so let's look at our third ask for just a minute. I mean, HR 1946 or Senate Bill 1873. I'm going to tell you, I've been here for 6 years. It's very rarely that we actually have a piece of legislation that we go in and ask people to either co-sponsor or support. So it's really exciting to have a bill number again, but this Medicare Multi-Cancer Early Detection Screening Coverage Act is huge, and I'm sure it's probably got an acronym that I will probably screw up.
Probably does.
But knowing that if you can detect cancer early, right, the amount of treatment you're going to need and the cost for that treatment should be lower, we would think, right?
Absolutely.
And so I'm excited about this, and I really think that that this legislation, that this Multi-Cancer Early Detection Screening Coverage Act, will fit in well with our guest today, who's going to be joining us here after the break. Her name is Deidra Wilson, and she's the vice president for government relations for McLaren Healthcare, along with Karmanos Cancer Institute. And so I'm interested to see, maybe we can touch on this a little bit with her and see how that kind of interacts with their group and their organization, and really maybe talk about some of their priorities. So, but anyways, Leadership Summit Lobby Day, what date are they actually going to be on the computer screen talking to lawmakers?
Yeah, so Tuesday, September 28th, all day, we will have, all of our volunteers here in Michigan meeting with all of the representatives, all of their Congress people, making these really important asks, trying to strengthen this access to care and these early detection programs to, try and just continue to fight cancer.
Yeah, so hey, you heard it here. If you're trying to get a hold of some of your friends that are volunteers here for ACS CAN on September 28th, You might not be able to get a hold of them because they may be busy that day.
They're going to be having very important meetings.
That's right. So feel free, leave that voicemail, shoot that email or text over. I'm sure they'll appreciate it. Or if you have an opportunity, just shoot them a quick note of encouragement, as they'll be working hard to make sure that those fighting cancer can get access to the care they need. So, well, here after the break, Deidra Wilson from Karmanos Cancer Institute. Stay with us. This is the CANdid Connection.
At Karmanos, we specialize in providing cancer care that you can't get anywhere else. Because we're home to one of the largest clinical trials programs in the country, only Karmanos can give you access to more than 250 of the most innovative and promising cancer treatments available. And with locations across Michigan and virtual visits, we offer easy and safe access to the expertise and guidance of your cancer team. We do all of this for one reason: to give you your best.
Welcome back. And so we mentioned on the other side of the break, we're really excited for our next guest. And truthfully, I don't have an opportunity to interview somebody that kind of does the same work I do. So I'm really excited that we've got the Vice President for Government Affairs and Public Policy, Deidra Wilson from McLaren Healthcare and Karmanos Cancer Institute, join us today. Hey, Deidra, thanks for taking a few minutes. We really appreciate it.
Oh, I'm happy to be here. Thanks for having me.
Yeah, so I can tell you the way that I've done my work here at ACS CAN has totally changed after the past 18 months. And, COVID has essentially, as you see here in my background, has now driven me home. And kind of changing the way that we do our work. I'm sure it has to be the same for you, but how has COVID really kind of affected how you do your work, and how has it really kind of maybe shuffled the priorities that McLaren Healthcare and Karmanos are really focused on now?
Yeah, you're right. And being in the same line of work, that a lot of what we do is being on the ground and being out there and actively educating the legislature and congressional delegation about the things that we do. And so it has been a shift, a dynamic shift, that's for sure. And certainly a priority shift too. I think while there have been pieces of legislation that have gone through, to name a few: surprise billing, prior authorization legislation, things that really affect the cancer policy space. By and large, we have been just completely engulfed in this pandemic. And it has actually created a new set of sort of policy priorities and these acute things that we really need to deal with. And in some ways, I like to think of the light at the end of the tunnel of the pandemic and sort of the good things we can kind of get out of this. And I think, one thing that has fast forwarded a lot, and I think it ultimately will help us all in the area of healthcare, is telemedicine.
Yes.
And so, a lot of the focus, we'd always sort of had a focus on telemedicine, and, we were in the early versions of that. Actually, McLaren and Karmanos had very robust telemedicine programs, but it really fast forwarded us, I think, probably 3 to 5 years of where we would have been. And it really has us being more innovative in the telemedicine space. And, in terms of funding and things like that, because, what we're really finding now, this sort of aftermath, and we're still in the pandemic, but really the beginnings of the aftermath are people not seeking their care. And nothing has been more prevalent, I think, as I look at our 15 hospitals around the state. We also have a hospital in Ohio, and we're seeing much more dire situations in the cancer space than we saw before. And so people have delayed their care. Now, when they come in, they're a lot sicker, and they have much more advanced stage cancer and disease. It's very prevalent in the cardiovascular space too. Unfortunately, people that may have had early stages of cardiovascular disease have already had heart attacks, and now they're much more advanced, similar to cancer. And so I think that has really shifted the messaging on where we like the government to act, and can aid us and assist us in being helpful on really getting out that message. And how do we do that on getting patients back, feeling safe? As you can imagine, in the cancer space, we're always very keenly aware of the safety issues.
Yeah.
And not that you aren't in the entire hospital space, but really with immunocompromised patients, we always take the most care and safety precautions to make them feel that seeking their care is sort of safe. But we've really had to tailor that now and really emphasize that even more and make people feel safe from this pandemic and global pandemic, as well as safe to seek their care.
No, absolutely. I know, our returning to screening initiative is something that we've been, trying to work on here, just not in Michigan, but nationwide, and really, emphasizing that need to go back and get screened. And how do you, I'm interested to kind of pick your brain here for just a second. And how does the state really play into that in terms of being a valued partner?
Yeah, we've started some initial discussions, and I think we're in a unique position. I like to really focus on our unique position of being an NCI designated cancer institute, one of only a handful in the country, and us and U of M are the only two in the state.
Yep.
And we love being partners with the U. I've often started thinking here more recently as I've received the data, that really presenting that data to the legislature and showing that stark contrast of the pre-COVID and the post-COVID inpatient, outpatient visits, severity of disease. I mean, we have all of that with all the funding that's coming in, both COVID and non-COVID related.
Mm-hmm.
Is there an opportunity even for a statewide campaign?
Yeah.
We have cancer registries. We focus a lot on data. We're very data driven, and the numbers are pretty stark. And I think it's all bundled into COVID.
Yeah.
But there are going to be various pockets where we see healthcare dramatically change forever. I think you're seeing it in behavioral health too. You're starting to see the behavioral health fallout of COVID. But I think there's a role. The state budget has allocated dollars for other things in terms of getting that data information out. And I think this is maybe a good opportunity in utilizing, whether it's the NCI designated cancer institutes, because it has that national feel to it. And National Cancer Institute feel to it. We'd love to be a part of that.
Yeah, no, that's great. And I think that that's something that we would love to be a part in too. So
Yeah.
how can, our volunteers or patients that are on the ground, what can they really do to kind of help in the effort?
Yeah, I think it's an education effort,
Yeah.
more than anything. I think you start out, and you look back now, it's been 18 months, and you can see the progression of how this would happen, right? We put off lots of things in our care.
Yeah.
And it starts off so simple, even the dentist. I was like, oh, I put off my dentist visit. Wow, I really need to go. 3 months quickly becomes 6 months and a year, and now 18 months. And with the diseases that we're talking about here, that can make all the difference. And I think really that is just an education to on the ground as we're talking to people, and you don't have to bring COVID into it per se. You don't have to, there's lots of politics and things. I think this is just a health and well-being education. And I think people probably will appreciate that, being reached out to for things that aren't just COVID, right? But COVID has kind of gotten in the way of some of the other care, and it will catch up. I mean, it's starting to catch up. And there's no question, now when we see our volumes in the hospitals, people are much, much sicker than they've been. And that's just across the board. I think every health system would report the same.
Gotcha. Well, I know that we're, we've been telling our folks to get back, and so, we'll, once things happen, things start to move, please let us know if we can help in any
Yeah.
way. And we would love to be a part of that. Let's kind of shift here for a second though, and the legislature's coming back, right? They've been gone for
Yeah.
their summer in what in work district or in district work period.
Yeah. In district work period.
Recess. Yeah. Let's just call it a recess, is what it is.
Yeah.
Um, but now they're coming back, and the clock's ticking. We've got 21 days before the state shuts down. Still don't have a budget yet. Couldn't meet their statutorily passed goal.
Right.
And so they've got that big hurdle. But what else do you think is out there that's kind of staring them in the face in terms of having to deal with, especially around healthcare here in the next few months as we go from here to the end of the year?
Yeah, that's a really good question. And I think, it's not just the state legislature too. It's the federal government is looking at, I think, all sorts of things also. And, for the most part, this is the unfortunate part. I think about the situation that we're in. I think we are in an unprecedented time where it's so focused on the money right now in the state budget, right? And we've sort of pushed the policy elements a bit to the side, unfortunately, because I think there's a lot of good policy out there to be had. And you fast forward a little bit, we're going into a very significant election year, the redistricting. So much of that will be swirling around, and I think policy falls by the wayside. And so things that I would like to see, let's start at the federal level, elements related to 340B, activity there. We follow that so closely. I think we're about to get some, higher court activity on 340B going into next year. But we really have to think about what kind of legislative changes or advocacy pushes we want to make in that space, because for the last number of years it's really been an assault on healthcare, which is assault on the best practices of cancer care, as it relates to Karmanos, for sure.
Explain what 340B is. I know you and I know, but there's some folks that are going to be like,
yeah. So I think the best way to dial it down, because it's a long, sort of complex element of the public health statute, is sort of preferential discount pricing on those drugs. In this case, what can be highly expensive cancer drugs, to provide care to the most disadvantaged individuals, those on Medicaid, those in rural areas, certainly the DISH areas, and critical access hospitals, which, McLaren very unique than the other health systems, many other health systems in the state, because we are 15 hospitals all around the state, and we encompass all of those. With Karmanos, obviously, down in Detroit, but each one of our sites around the state is a Karmanos designated site. And so with the critical access that we have in the Thumb, Caro, that kind of population, Lansing, Pontiac. I mean, we cross so many geographic regions of the state that the 340B preferential pricing applies to help those populations. And without that, there's it really does dig into the ability to provide the best cancer care to people, solely based on affordability. Which is never what you want, right? You never want a situation where you have a sort of health solution or a health path of treatment, and you just can't afford it, right? I remember we talked about, yes, that's exactly right. I'll never forget, I was in grad school, so I have a master's in public health from U of M, promoting U of M here for a minute, although I'm a Spartan fan too, went to MSU too. I remember we talked about this once, and the professor was like, one of the greatest public health successes ever mammograms, mammogram screenings. Look what we've been able to do with that. Yet we always run up this barrier of the access to care and the payment to care, and how sad it is you come up with such great public health solutions, but you just can't provide it to people sometimes. And so, there's really been this, again, assault on healthcare, really from the drug companies in a lot of ways, and even previous administrations just not being as helpful in that space. And I think us, particularly cancer-only hospitals, that really, we really live and breathe on being able to provide that kind of discounted care to folks because of our populations. So that's just sort of a small look at 340B, but there's so many things swirling around it. HRSA's gotten involved because of some of the drug companies' actions. So we nationally, all the health systems have really been engaged in that. Of course, there's been some litigation and court action on that. So we'll watch that. And at the state level, I think things you mentioned like oral chemo and things like that, unfortunately, I think they just sort of shift and don't get as much attention and spotlight because there is so much of this focus on the money.
Yeah.
Now, while it's not where our priorities may have been, you have to seek the opportunity where you can to make the best out of the situation. And I think there's opportunity there for one-time funding for things that we just never had the opportunity to do before. I'll give you an example too, and the federal side of things. This is the first time in 11 years that they've brought back federal earmarks for community project funding. And we are in the running. Thank you, Senator Stabenow, for picking Karmanos and our Proton Center in Flint for a project and expansion on proton therapy. So great opportunity, great use of dollars that really does fall in line with the original intent of where these earmarks and community project funding was supposed to be. And so we're thrilled they brought that back. And that we've been in the mix and the opportunity to be able to put forward our grant opportunities.
That's awesome. That's awesome.
Yeah.
As we talk about funding, and I've been now with the Cancer Society for 6 years, and I was at the Medical Society before that. One of the things we always talked about was preventative care.
Yeah.
And I always feel that we're really good at spending money in terms of dealing with problems on the back end.
Yeah.
But we're not very good about dealing with issues on the front end and dealing with prevention. And so I just, what do you feel about that? And are there avenues you feel like that maybe we could invest in some more prevention stuff, and that kind of gets us back into talking about getting people back screened again, trying to do some other work? I want to say maybe vaccinations, at least in our end, when we talk about HPV,
absolutely.
Do you feel that we maybe one of those solutions may be looking at maybe doing some investment in prevention work?
Yeah, absolutely. And I think you're so right too. I would say, COVID gets the spotlight, but let us not forget about other vaccinations. Let us not forget about other things. And we've seen the statistics on that. Really scary stuff on people missing out on their vaccinations and what could that lead to. And HPV is a great example in the cancer space. It's been a really big public health success, I think, in a lot of ways. And so we don't want to take ourselves back too many steps. And how unfortunate is that this could lead to that. So I think you're right. I think doubling down on prevention it is critical now more than ever. You're right. We haven't invested in it. We tend to do that, in the federal and state level, it's crisis mode, right? Like we really throw money at things. It's like when, I mean, I was actually in DC when they were working on HIPAA. Years and years ago. I'm like, oh, here we are. We get to this like critical point. You do this massive thing, and then you spend the next decade working on it because you're like, it was so crisis that you didn't do it right the first time. And you didn't think about 100 things. And I think this is one where you don't need to do that. We know what works, we don't need to haphazardly go about it. We know how to systematically lay out the plan to stave off the problems. And so, yes, I absolutely think there's great opportunity. You talk about opportunities we can work together. I think there are numerous. I've seen several grant opportunities come down federal level and working in these coalitions with various hospital systems, different associations on doing that very thing in communities. And there seems to be a lot of targeting, not that it's not for the entire population, but
Yeah.
a really focus point on the rural areas. We have a lot of rural areas in Michigan. So it just seems like when you look at all the benchmarks and the metrics, it's really stark. It's like some of the really city central areas and then some of the really outskirts areas. Everybody in between is sort of doing a little bit above, but really there's a stark look at where we're seeing a decline in things. And I think there's really good opportunity there and opportunities through funding as well.
Yeah, no, absolutely. And that could lead me down a whole nother rabbit hole, as health equity and health equity issues
Yes, right.
are like on our radar now more than ever. But unfortunately our time is running a little low. So I'm going to ask probably the most important question,
Sure.
at least I feel like, for our time today, is that, being a MSU Spartan fan, how many wins do you think the football team's going to get this year?
Oh, I am rooting for Tucker. I am
I
rooting for
know.
Mel Tucker. I have to say, as having a hospital in Lansing, and I'll give a totally shameless plug for our new hospital and our new Karmanos Cancer Institute here in Lansing. We're very excited to open in March. The Tuckers have been very good supporters of us and our community and our fundraising efforts, actually, in the community largely, which will go to our Karmanos Care. So I am really rooting for him. I don't know. They look good. This transfer portal situation has really been a game
I know,
changer.
right?
So
I
I'm
know.
like, yeah. And I love football, but I really love college basketball. So I'm looking
Okay.
forward to getting back to that too.
Yeah, no, me
Yeah.
too. Me too. Well, hey, when things open in March, we would love a walkthrough to check it out as well. I know we're very excited about it. So
We'll get you there before. They're doing tours all the time now, and they're fantastic. I actually just went on the first one I had been on in a while, since like April, and I cannot believe like how much it has been accomplished. It will actually mostly be completed by December, and then we just have to go through all the certifications and all that. So this is a great time. We'll get you out, or anybody that's interested, I'll throw it out there. It's really fantastic. It's very rare you get to see a brand new facility, coming to a community. So we're really happy.
we're excited about it too, living here in the Lansing
Yeah.
area. So, well, Deidra, thank you so much for
Thank you.
taking some time today. We appreciate your insights and good discussion. I felt like we could have gone on for
Yeah.
another 30, 40 minutes talking about stuff. But again, join us today, Deidra Wilson, the Vice President of Government Relations and Public Policy for McLaren Healthcare and Karmanos Institute. Thanks again for joining us. We appreciate it.
Thank you. Have a good one.
Yep. Well, and that wraps it up for our September CANdid Connection podcast. As you know, it is our Leadership Summit Lobby Day, so our volunteers will be heading to Washington, D.C. virtually here at the end of the month. So feel free, join us in October, as our president of ACS CAN, Lisa Lacasse, will be joining us and really kind of sharing her impact on how things went, and providing us some takeaways from our time in DC. So with that, thanks for joining us, and we'll see you in October.